Hey everybody, Dr. Chris here. Brace yourself. You ready? Red meat. Processed meat. Ooh, that gave some people the gibblies. Other people are saying, yeah, bring another burger. Keep it coming. All right, so how do you feel about red meat and processed meat? I think the traditional teaching is that too much red meat, too much processed meat is bad for you, right? It gives you cancer, gives you heart disease. Where do those ideas come from, and are they still true? So we're going to talk about a handful of studies here that have just tons of information, tons of patients that were looked at in these studies to give us a little better idea of what kind of effects red meat and processed meat have on health, okay? And then by the end, you'll be able to decide, hey, are you going to be a bacon, red meat, processed meat kind of person? You're going to be a banana, let's not touch the red meat kind of person, okay? Let's get to the information. So this issue of Annals of Internal Medicine has 5 studies on red and processed meat consumption. I'll just check them off as we go along here. So there's one on mortality, cardiometabolic outcomes. There's one on cancer mortality and incidence. There's one on higher versus lower red meat intake. There's one about patterns of eating. And then there's one about people's preference regarding meat and changing behavior. And then what I'm going to zoom in here on and highlight the whole thing is this clinical guideline that makes recommendations based off of these pretty comprehensive studies. So here's the punchline with unprocessed red meat versus processed meat and red meat. Okay, so here are the recommendations from this panel. The panel suggests that adults continue their current unprocessed red meat consumption, which is a weak recommendation, low certainty evidence. Similarly, the panel suggests adults continue current processed meat consumption, which is a weak recommendation with low certainty evidence. Say what? Some question marks, exclamation points. So the conclusion after looking at all of these studies is really a bunch of question marks, okay? And these were big time studies, these meta-analyses combining a bunch of other studies to get sufficient power to make some conclusions. I mean, there were millions of different people looked at in these studies. So big time studies combined, and a lot of the questions remain afterwards. Okay, and even the associations that they did find with decreased risk of cancer, heart attacks, those sorts of things, really, really small changes, and even questionable if they existed or not based on the quality of the studies. All right, there's a lot of inherent trouble with studying diets. Recall is notoriously bad. Okay, no matter how close you think you're paying attention, most people are off enough to affect study results. Okay, so that's one thing, just the recall of the diets. Another thing is that people change their diet all the time. People don't eat the same thing every day. They might eat the same thing for a week, a month, even a year. But when you're looking at people over many, many years and trying to figure out what's healthy and not healthy, it's hard to do and to make firm conclusions. Okay, so this is going to be controversial, right? Because a lot of people say, of course my doctor wants me to eat less red meat, all right? And either, hey, I do it because I want to be healthy, or, I don't want to do it because I like red meat. Or then there are people who say, Western medicine, they don't know what they're talking about. Red meat is fine, so I'm going to eat it. And these studies show that we don't really know who's right, okay? So of course we always say, hey, we need more study, we have to get more evidence to figure this out. And yeah, I think that's true, but in the meantime, I kind of stand by their conclusions, right? So if you're eating unprocessed red meat, this suggests it's probably okay to keep doing so until we have more information. And if you don't want to eat processed red meat, fine, you don't have to start doing it, okay? So kind of reassuring for a lot of people, maybe frustrating for other people, but that's where we are right now. So thanks for listening to me. Hope you learned something. Get a hold of me if you have any more questions. We'll talk to you next time. Dr. Chris. Be sure to schedule your free 30-minute initial phone consultation by sending me an email or by visiting our website at refinedwellnessconsulting.com.